The reality is that the WHO failed to adequately obtain, vet, and share information in a timely and transparent fashion. The WHO failed in this basic duty and must be held accountable. It's time.
Hello and welcome to The Nexus. Today's question, a simple one. Who's to blame for this coronavirus nightmare? Well, if you were listening carefully at the beginning of the program, you would have heard President Trump blaming the World Health Organization, which he believes failed to protect us from the spread of the virus, largely because it was afraid to offend the Chinese government.
Everybody knows what's going on there.
But the WHO's Director General, Tedros Adhanom Ghebreyesus, a man few of us would have recognized last year, has batted away that criticism and has actually thrown a counterpunch at President Trump.
Please don't politicize this virus. If you don't want many more body bags, then you refrain from politicizing it.
So who do you find more credible? We'll look at the more serious allegations against the WHO in a moment with our guests, including a virologist in the UK who believes the WHO should have challenged China more, and an Ethiopian academic who knows Tedros and says that's just not his style. But first, a quick summary of how Tedros and the World Health Organization has performed since the beginning of the crisis.
Good evening to everyone in the room. Sorry for keeping you waiting. I'm not declaring a public health emergency of international concern today. At this time, there is no evidence of human-to-human transmission outside China. Make no mistake, this is an emergency in China, but it has not yet become a global health emergency.
3 cases have been confirmed in France.
The second patient in the United States.
Coronavirus confirmed in Canada.
A short time ago, the World Health Organization declared the outbreak an international public health emergency.
The main reason for this declaration is not because of what is happening in China, but because of what is happening in other countries.
We are waiting to hear whether they make any recommendations in regards to travel and trade.
There is no reason for measures that unnecessarily interfere with international travel and trade.
The window of opportunity to contain the international spread of the coronavirus is closing.
The WHO maintains it's too early to call it a pandemic.
Are we there yet? From our assessment, not yet.
Despite the ongoing COVID-19 outbreak, the World Health Organization has heaped praise on China over the way Beijing has dealt with the issue.
The measures taken in China have averted a significant number of cases.
For the first time, there are now more new cases reported from countries outside of China than from China.
Worldwide, cases of the coronavirus have surpassed 100,000.
And the deadly COVID-19 pandemic is setting records by the day.
We expect to see the number of cases, the number of deaths, and the number of affected countries climb even higher. We have therefore made the assessment that COVID-19 can be characterized as a pandemic. We have rung the alarm bell loud and clear.
Well, did they? Let's bring in our guest now, and we have Dr. Mohammed Munir standing by in Lancaster University. He's a virologist there. He's been following the WHO very closely since the crisis began. And we also have Yuan Ren, who is a freelance journalist originally from Beijing, now based in London. Dr. Munir, let's start with you. Just very briefly, how would you rate the performance of Dr. Tedros and the World Health Organization generally during this crisis?
World Health Organization have been engaged with the overall outbreak right from the beginning, and they've been very actively briefing the world and the progress over it. However, there have been few clinches that definitely required reconsideration over the time, but generally the response overall could have been better than what they have so far.
Yuan, same question to you.
I think WHO has acted in a very diplomatic way, and I think perhaps it could have been a bit punchier. in its decision making. But I think I get the impression that it's trying to get consensus from all of the member states.
Well, of course, to rate the performance, we actually have to establish what the WHO's role is. And as a branch of the United Nations, its stated mission is to promote health, keep the world safe, and serve the vulnerable. And to reach those lofty goals, it is given something like $4.8 billion a year. A fair chunk of that is spent on its 7,000 staff, including its boss, Dr. Tedros, who's reportedly paid around $250,000 a year. It's important to know that the biggest funder is the United States by far. Number 2 is the Bill and Melinda Gates Foundation. The UK is up there too. China way down the list. Now, if you remember, last week, President Trump actually suspended funding to the WHO to the shock of many people around the world. But of course, he had his reasons. Let's start with this one.
Today, I'm instructing my administration to halt funding of the World Health Organization while a review is conducted to assess the World Health Organization's role in severely mismanaging and covering up the spread of the coronavirus. Everybody knows what's going on there.
So that's accusation number 1, that the WHO, in a way, helped China to cover up the spread of the coronavirus. Dr. Munir, do you think there has been a cover-up?
Well, if we look on to the start of this outbreak, the number of cases, those being reported on day-by-day basis, and if we apply all mathematical modeling and epidemiological prediction, those were not fitting really into any of the scientific curves. So right from the beginning, the scientific community has been speculating that the number of cases that are being reported are not really the actual representation of the overall severity. So the whole scenario became even more clear soon after that. The number of cases were down, and also the overall picture has not been revealed to the whole world, so that the rest of the world could have been better prepared. And if that would have been the case, probably the overall situation, the gruesome situation we are in now, could have been better.
So even from your position, watching this all on television and reading the newspapers and the press releases, you're saying that you could tell as a virologist that China's numbers weren't adding up.
That is true. The overall situation was like this, that the number of cases that were increasing, as you can see from, if we look onto the data later from the other European countries, we very clearly can see that every second day or the third day, and in the later curve of the outbreak, every 5th day, the number of cases were doubling. But that wasn't really the situation back in China. So that didn't really give the true picture, the scale and the intensity of this outbreak, and that led to miscalculation of all the preparation that was required in other countries.
Yuan, do you think there's been a cover-up?
No, I don't think there has been a cover-up at all. I think, of course, with data, as we're finding out as this virus spreads across the world, that data is not reliable, because there's obviously a huge underestimation of all data from all countries. Just in the last week, we found that there were 1,000 extra cases coming from care homes in the UK, and that you can't say that's a cover-up. That's a delay. That's the system, as it were, adapting. And of course, locally there were errors made, and I think that there's no doubt that, of course, something could have been done sooner. But to say that some sort of big cover-up happened, I think well,
the thing is, I mean, we've looked through hours of WHO press conferences, and it is quite plain to see that Tedros and his subordinates have praised the Chinese government constantly during the outbreak, even as Chinese scientists and journalists were being gagged. Now, remember what happened to Li Wenliang, an ophthalmologist at the Wuhan Central Hospital, who on December the 31st, New Year's Eve, warned people on WeChat that there had been cases of coronavirus infections in Wuhan. Tell your family and loved ones to take caution, he wrote. Well, a few days later, he was interrogated and threatened by police, who forced him to sign a letter saying he was wrong and wouldn't do it again. He went back to work and contracted the virus from an infected patient. He published his experiences online, and millions of people saw it. The 33-year-old father died from COVID-19 on February the 7th, and his death was reported around the world. And what was the WHO's response? Well, it tweeted out this. It was saddened, and his work on COVID-19 should be celebrated. Meanwhile, the WHO's effusive praise of China and how it was handling it continued. Here's Bruce Aylward, who led the WHO's mission to China, giving an interview to the Chinese state-owned China Daily.
So when you brought that public health expertise together with the population and some pretty strong leadership and big decision making from the people at the top, you had the combination you need to beat a virus like and a disease like COVID-19. I think one of the great things of China was it was willing to share its experience, share what it learned with the rest of the world, very, very openly, very transparently in what we saw.
Very, very open, transparent. Dr. Munir, would you agree with that?
Yeah, I think the real point really here is that the preparedness in this kind of situation when the infectious disease is really taking this world by storm is critical. And if the proper information is not conveyed right at that time, the preparedness would be sabotaged. And that is where the whole scenario lead to a gruesome situation. Taking into perspective, for example, the situation of Italy hasn't been because of their poor healthcare system. And it has been because basically the information they've been given was really late. And because of that, they were not able to ramp up their even the diagnostic capabilities, their healthcare system. And these late preparation and heavy penetration of the infection, especially when we talk about majority of those cases were asymptomatic, that led to the overall circumcision basically of the whole system. And that's how the overall impact has been very high. So yes, certainly there has been a cover-up, and there would have been much better situation if the whole transparency would have been considered.
Yuan, when you consider what happened to that doctor in Wuhan and others and journalists, I mean, do you really think it's right for the WHO to praise them as transparent and very open?
I think with Dr. Li Wenliang, when he raised the alarm on the 30th and then was rebuked, actually by the 31st, the market, the wet market was closed on the 1st of January. By the 31st, the WHO were informed of 44 cases of atypical pneumonia. So that was reported. And if you think about the way that him as a whistleblower, as it were, telling in these WeChat groups, these social media groups about this, you can understand why people wouldn't want to take that as confirmation. In the same way with patient confidentiality.
But is it reason to be dragged in by the police, interrogated, and then told to sign a letter saying you won't do it again? Is that all right? Is that transparent and open?
I don't think that's okay, and I think that that's being acknowledged that was wrong. But in terms of going then to investigate the rumors, I mean, they were at that point rumors. I don't think anyone at that point could say that this was this new coronavirus, COVID-19, and it was human-to-human transmission. It was early days. WHO were warned of it at the beginning of January. And I think it's fair to say, while there were mistakes, it takes time to confirm before you start telling the world that, this epidemic is...
Just on the matter of transparency, though, I know you're saying that China did warn the WHO about it, and therefore maybe it's okay for the WHO to say it was open and transparent, but there are a number of press reports, for example, South China Morning Post, saying that they have government documents that indicate the first case was identified on the 17th of November. You have an AP article saying that the Chinese government knew that it would be a pandemic on January the 14th, but didn't share that with their own people, let alone the world. And then we often hear that they've shared this, the RNA sequencing very quickly with the world, but actually they had it completely mapped out on January the 2nd, and it took them a week. They held on to it for a week before sharing it. So I don't know if it really stacks up that they were open and transparent.
I think they managed to sequence it on the 7th. That's the date that I know of, and then shared it on the 12th. So yes, that's about 4 or 5 days later. But just purely having the RNA sequence doesn't mean this is a human-to-human transmission.
No, but it goes a great way to help actually developing a vaccine or in other treatments?
I think yes, a vaccine would have. I mean, a vaccine is going to take about a year, so I don't think that would have made any difference. But it did. I mean, 4 days to share that with the world, and Germany then helped with developing a test very quickly, and the US. If you think about what the US did was instead of doing what Germany and taking that advice to develop the vaccine, it chose to use its own vaccine protocol, which then delayed it further, and it's why that it wasn't able to test as widely as possible. So I would say actually from the alarm bell of end of December, beginning of January till the 7th is actually quite a quick turnaround. And
okay,
that was...
Let's go back to President Trump now and allegation number 2.
One of the most dangerous and costly decisions from the WHO was its disastrous decision to oppose travel restrictions from China and other nations. Fortunately, I was not convinced and suspended travel from China, saving untold numbers of lives.
Now, to be clear, President Trump's travel restrictions were announced on January 31st, and that was a travel ban on foreign nationals who had recently visited China. That was a full month before the first death from COVID-19 in the United States. The WHO and some in his own country opposed him on that.
There is no reason for measures that unnecessarily interfere with international travel and trade. We call on all countries to implement decisions that are evidence-based and consistent. WHO stands ready to provide advice to any country that is considering which measures to take.
Banning all travel from Europe or any other part of the world may slow it, but as we've seen, it will not stop it. And travel restrictions based on favoritism and politics rather than risk will be counterproductive.
Dr. Munir, do you think that President Trump did the right thing by imposing a travel ban from China?
Well, I think the important thing really is to look into the data and how it guides us. If we look onto the number of cases, those being reported outside of China right from the beginning, majority of those were the ones that traveled from China and moved to other countries, especially at the time when the human-to-human transmission was not really clarified by the World Health Organization and the Chinese government, and asymptomatic carriers of the infection. So looking onto the pattern of the disease spread, certainly the travel restriction would have helped to limit the spread of this infection. And if the governments, whoever the government, for example, the United States and some other nearby states, they have put restrictions onto the movement, that is probably the right situation that they would have considered at that particular time.
Yuan, do you think the President of the United States did the right thing by shutting down travel from China and from people who had visited China in the past 14 days?
I think shutting down travel completely isn't really helpful because you could get a flood of people trying to get in before the shutdown happens. People are going to, with these restrictions in place, going to lie about how they're feeling. And what's more important, and I think that's something the WHO have continuously said, is contact tracing, testing. There's only so much you can do physically with this virus to stop it moving around the world.
Okay, let's have one more soundbite from President Trump now, and the third allegation. And he said that the WHO failed to challenge China when it said there was no evidence of human-to-human transmission.
There was credible information to suspect human-to-human transmission in December 2019, which should have spurred the WHO to investigate and investigate immediately. Through the middle of January, it parroted and publicly endorsed the idea that there was not human-to-human transmission happening, despite reports and clear evidence to the contrary.
Now, when he says parroting, he's probably referring to this tweet on January the 14th from the WHO, which says, preliminary investigations conducted by the Chinese authorities have found no clear evidence of human-to-human transmission of the novel coronavirus identified in Wuhan and China. Now, as I said, that was January the 14th. Dr. Munir, do you think the WHO should have just repeated the guidance from China, or do you think they should have publicly challenged it?
I think in the whole scenario, one of the biggest mistake has been that WHO and the China has been playing on to the human-human transmission. And I think this report came by mid-January, and before that, it was already evident that people who have not visited the wet market, they were also positive for coronavirus. And healthcare workers in the hospital, they were also getting infection, and the majority of them end up in a very critical care. So it was very evident from the beginning that the human-to-human transmission is possible. And also, this is not the first coronavirus we have seen. We have seen SARS and MERS. Those coronaviruses have been transmitting from human to human. So therefore, there were strong evidences to believe that this would be the case in the SARS-2 here in the COVID-19. But not only that they reverted back, but they've been disseminating this information, and this information, when it reached to the general public and also the other countries, they were discouraging, this information was discouraging other countries to put any restriction on travel because they thought human-to-human transmission is not possible. So this is one of the major mistakes that led to spread of the disease globally in a very short time.
Dr. Mohammed Munir, thank you very much, and thank you, Yuan Ren, both of you, for your contributions to the Nexus today. We're going to move on now to Dr. Tedros's homeland, Ethiopia. And we're very fortunate to be joined by the academic, Dr. Muhari Mauru. Dr. Muhari, you know Dr. Tedros very well. What do you make of the accusations that he's China's puppet?
Well, not at all. I think Dr. Tedros is not a puppet of anyone. He's not in the pockets of any other person or a country. He's known for his independence thinking. He's very diplomatic, but he knows his business very well.
Of course, a lot of people will accept that it's not really his fault that he's received imperfect information from the Chinese government, but they would say he ought to have at least stood up where appropriate in public and said, you know, I'm not getting the full picture and I'm not happy with the Chinese. But you don't think that's his style, right?
Not at all. I mean, he's a man who can work with others, try to convince them on to do what is best for the country and the globally. I assume he has discussed all this behind the doors with the Chinese or other countries, and at the same time, I think for international organizations. Increasingly facing stiff attacks from many political parties which are nationalist. It is trying times for leaders of multilateral organizations. So for him as an individual whom I know, and also as Director General of W.H.O, multilateral organization facing significant financial constraints, he would, I assume he would try to bring all countries together. And in that, he will have to balance the interest of national countries. And that is a delicate balance to be made.
Now, you say he's very diplomatic and he's not prepared to air his dirty laundry in public. But of course, after President Trump suspended the funding to the WHO, he came out and said, without referring to President Trump directly, but he said, if you politicize COVID-19, you better be prepared for many more body bags. I mean, that was pretty tough language.
Yes, it is tough, but it is tough because it's a pandemic issue. If it was not related to the pandemic, I think he wouldn't have used those words, and he wouldn't politicize it himself.
Now, his critics refer to his Marxist background and say it's only natural that he would have would express favoritism towards the Chinese Communist Party. Can you answer both of those things? What was his Marxist background, and is he ideologically driven?
No, as far as I know him, he's not ideological. The least ideological person in the ruling party of Ethiopia, where he used to serve as one of the leaders. He opened the door of Minister of Health. For a long time, the Minister of Health was closed door. It has closed door policy. Was not willing to cooperate with many partners before his arrival. With regard to the previous ideological background of the party, first of all, the Marxism has died long time ago in the ruling party. And he came to power or to these high positions after the end of this ideological position of the ruling party. It's just simply an attack on his person rather than an actual fact on the ground.
And from what you know of him, do you think he can withstand this criticism from the United States and elsewhere? Or do you think he's going to quit soon?
I think he's not a quitter. He will continue the way he is doing. He's not going to antagonize anyone, regardless of an attack that is made on him. He's trying to bring all, including those who accuse him, attack him, criticize him, on board, so that WHO is a real multilateral organization that can bring all actors from west to east and also north to south. And that is the reason why he is capable of withstanding the current attacks, and WHO will come out as a strong organization.
Dr. Mahari Maru, thank you so much for joining us from Ethiopia.
Thank you for having me.
And thank you at home for watching. Appreciate it as always. Remember, you can see this episode and all our previous episodes on the coronavirus on our channel on YouTube. Until next week then, goodbye.